Hi, my name is Stephanie,
I'm Violeta.
And I'm Julia.
and this is our anatomy movement presentation. We are doing this presentation because we feel it is very important to know about human movement. Since every joint and muscle moves on a specific axis and plane, not knowing which body part moves where could result in unintentional injury. Therefore, it's important to know all about the anatomical movements to aid in better understanding any communication or swallowing disorders when diagnosing as an SOP.
So we're first going to begin by talking about flexion and extension. So I chose to refer this movement to the knee. So flexion and extension. Flexion is the bending of the joint, and this is going to occur where the angle of the joint is decreasing. And extension is the opposite. So you're straightening that joint and increasing the angle of the joint. Next, we have left and right rotation. I chose to demonstrate this with the spine. And so this is turning the neck to the left and to the right, rotating that cervical spine in each direction. Then we have side bending or lateral flexion. So this is the movement of the body where I'm turning it to the side and I'm moving it away from the midline of the body. So that's us turning it to the side. And then lastly, we have protraction, lower cervical flexion with upper cervical extension. So the head is moving further relative to the shoulder. And so this is happening where there's two things occurring. So the upper region of the neck is flexing, the lower region of the neck is flexing, and the upper region is extending at that same time. Thank you.
Now I will go. Okay, so first I will be showing retraction, lower cervical extension with upper cervical flexion. So as you can see, I'm retracting, then going into lower cervical extension, and then upper cervical flexion. And then next, I will be showing internal external rotation using the shoulder joint. So as you can see, I'm doing internal rotation, which is when you rotate the shoulder so that the thumb starts pointing to the midline or the axis of the body. And then you could see external rotation, which is when you rotate the shoulder so that the thumb faces away from the body. Next, I will be demonstrating medial lateral rotation, which is similar to the previous internal external rotation, and I'll be using the hip joint. So this is medial rotation, which is when the foot is facing towards the axis of the body, and then lateral rotation, which is when the foot is facing away from the midline. And then finally, abduction and adduction. And then in this case, I will be using the shoulder joint to demonstrate the movement. So this is abduction, which is when the movement of the joint goes away from the midline of the body. And then that's adduction, which is when the movement of the joint is towards the midline of the body. So although I'm showing this movement with the shoulder joint, it could also be performed with the hip, wrist, and fingers.
In this first clip, I will be demonstrating pronation and supination of the forearm. Pronation is when the palm is facing down, and supination is when the palm is facing up. And pronation and supination, you will see the radius go over the ulna. In this next clip, I'm demonstrating dorsiflexion and plantar flexion. Dorsiflexion is a backward bending and contracting of your ankle, and plantar flexion is pointing of the ankle. This can be also done in the hand as well. And this is dorsiflexion, plantar flexion. This is circumduction at the wrist joint. Circumduction blends all the movements of flexion, extension, abduction, and adduction to create a circular motion. I like to think of circumduction as creating a circle. And this is abduction and adduction of the vocal cords. When our vocal cords are abducted, the vocal cords come apart and they let air in and out to allow us to breathe. When the air is adducted, that means the vocal cords come together. It often creates a sound because the vocal cords are vibrating. And that's how we trap air into our lungs. Thank you.
So this concludes our presentation of us demonstrating the different movements of our body. We hope you enjoyed it. We see the relevance in doing these movements as it can help us better understand and thus assess clients or patients in the future as SLPs.
Okay, now I will share our references. Okay, these are our references. Thank you for watching our presentation. Bye.